Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats. We have our friend Alicia with us. You do not want to come and be on our podcast and be awesome, because we'll just keep talking to you. We will just keep talking to you. And Alicia is awesome, and she is doing wonderful things in the wellness arena. She has, she's a nurse practitioner. She's a health coach. She has Radiate Health and Wellness. You should follow her in all the social media because she's doing fabulous stuff. She always makes me laugh. At one point it was like, I'm coming to you from the basement, because she didn't quite have her basement done yet, but the basement's done now,
Basement's done.
Yeah.
Thank
So,
goodness.
when you can follow people on social media and know about how their house is progressing,
It's
it is good. It is great. But Alicia shares some great information in social media, and she is going to help us today talk about what's kind of a hot topic, microdosing GLP-1s. All of us are advocates for GLP-1s. GLP-1 is the drug class for semaglutide. Semaglutide is branded as Ozempic and Wegovy. And then we have a GLP-1 GIP combo, but I think it sort of just kind of gets umbrellaed under GLP-1s. And that's Mounjaro and Zepbound, and the generic of that is tirzepatide. And so now there's a lot of conversation. Someone said to me months back, what is this microdosing? I was like, I know not what you speak of. Because it's really, it's more happening it's very off-label use, and it's kind of happening in the parameters, kind of the periphery of medicine. But what is microdosing of GLP-1s, these weight loss medicines?
So microdosing is using the GLP-1 for another reason other than weight loss, which I don't even call them weight loss medications anymore, because the more research that we do.
And certainly they came out first as diabetes medicines, but they are medicines.
Well, and they just got the indication, or at least tirzepatide, for obstructive sleep apnea.
Yes.
There's phase 3 trials in dementia and
addiction,
fatty liver disease is still
so
in
like
trials.
that's because there's GLP-1
stroke
receptors.
prevention.
Yeah, there's GLP-1 receptors in multiple areas of the body, and so we're seeing that the benefit is much more than just weight loss or A1C reduction.
And if you have a question really on more about what are these drugs, Amber and I did a very detailed semaglutide episode over a year ago, where we talk about what is it, where is it made, what are all the target tissues. There are many, many places in the body that are target tissues for this. It acts in a lot of different ways. And so what we're finding is that the GLPs approved first for diabetes, and they are some of the most powerful sugar-reducing medications. And their side effects tend to be things that we were finding are excellent. So at first we found that people lost weight, and then it became approved as a weight loss medicine. That, of course, is what it gets talked about the most. But then it got approved, and we're finding people are getting started on these by the cardiologist because the GLP-1 medication, semaglutide, has been found to decrease risk of cardiovascular, stroke, and heart attacks. And so also approved for that, but we are expecting approvals to come in the coming years for so many other things.
Which is exciting for medicine.
Very exciting. These medicines are revolutionizing medicine in so many ways. They're brilliant medicines.
They really are.
And so we're finding that they help for many more things than just weight loss, which is where most of the conversations lie. And one of the things is that they help with inflammation, that they decrease inflammation. We believe there are so many things that create chronic inflammation. You know, what some of the conversation, the first thing that comes to my mind is recent years long COVID. And so what happened when someone had COVID? Their immune system went nuts, and then they didn't feel good for months or years after. And we believe chronic inflammation is one of the downstream effects of some of these things. Autoimmune diseases. There are so many things that leave people just kind of inflamed throughout their body. And we believe GLP-1s may help with that as well. So you use GLP-1s for what kind of things that aren't the traditional weight loss?
So I use GLP-1s personally. I started 3 years ago for weight loss, and when I got to my goal after about a year, I kept on it as a maintenance. But as I've seen all of the research come out for inflammation, they're testing it in Parkinson's, neuroinflammation, and being somebody who's genetically prone to dementia and memory disorders, I'll stay on it as long as I can, because I feel like the cutting down of that inflammation in our body everywhere is only going to make us healthier. So it's funny because the woman who kind of coined the term of microdosing, Dr. Tina Moore, has said that she wishes now that she hadn't called it microdosing. She wishes she had just called it personalized dosing for things other than weight loss. And when she first started doing it, she did it more for patients who were already pretty metabolically healthy, that were doing the right things, eating the right foods, exercising, but they were looking for that thing to kind of get them to the next level of wellness. And so she started using it more for just kind of general wellness, longevity. And then the research kind of followed behind her to say, hey, you're right. We can increase people's wellness and longevity using GLP-1s for more than just weight loss. So decreasing inflammation. I've had patients that came off of it when they reached their goal weight, but went back on because their knees started hurting when they came off of it. Helping patients with PCOS. Anecdotally, some of the patients have gotten pregnant while they've been on GLP-1 that have PCOS because it decreases that insulin resistance.
I mean, there's a whole Google Semaglutide babies.
Yes, Ozempic babies. Absolutely.
Ozempic babies. And it comes up that, and maybe it's because of weight loss, because when people are obese, it screws up, it's a hormonal issue and it screws up their hormones. But also, does it help to regulate your body in better ways? And so with PCOS, does it help to regulate?
Yeah. But kind of the thought behind it is there are people who need insulin, and we need people who might be diabetic need different levels of insulin. So people who are deficient in GLP-1 hormone, maybe they need different levels of the GLP-1 hormone. So we start at a very small dose, and then we increase it only as needed. That's one of the things the side effects can come as we increase the dose either too quickly or too high. So, for instance, for weight loss patients, if my patients are losing 1 to 2 pounds a week, we don't move. We stay at the dose. There's no reason to keep increasing. And if we're having side effects, then we back it down and we stay at that level until we get the side effects under control.
When at least for the weight loss, often I'll find if patients are not losing weight at the current dose, they've done something different. Like they're not as paying attention to their nutrition as much. Like usually that's what I find. I'm like, we don't need to increase the dose. You got to eat better.
Absolutely. And I have a sheet that I'll send to my patients if they come to me and they're like, hey, I've plateaued. And I'm like, okay, here's your list.
Yes.
Have you optimized all these things before we even talk about increasing your dose? And usually the answer is no. Increase your hydration, your protein, your exercise, your movement, all of these things. So there are so many reasons to use GLP-1s, and I think the research is just going to keep coming, and we're going to get more and more reasons.
We're going to see more and more. There's even kidney function. There's a good study that was recently published about improving kidney function and helping people with chronic kidney disease. So I think we're going to see that it gets approved for a lot of other things. I think it's important to point out, and we all three sit here 100% on board for doing this, and knowing that it is not FDA approved and there is not a lot of research to back it up. But here's the deal. I personally spent $200,000 on an education and learned about all of these things. And then a lot of what we do in the practice of medicine, not the 100% research-based science of medicine. We don't say, I'm going to go science my way through the day. We're going to practice our way through the day. And what we do in that is we take the information we have, we take the person who's in front of us, and we really do everything we can to first do no harm, and we try to do the best we can for that person. And so there are times when I will give what would be in the research considered a subtherapeutic dose. So, if we're taking a blood pressure pill, we'll say these are the doses, and we think this is about how much it'll lower your blood pressure. They don't study every single little dosing change. And so then we take that and we extrapolate from that to say, well, if I jump from a 20 milligram lisinopril to a 40 and I get this, then if I jump to a 30, I'll probably get this. And if I cut it in half to a 10, and there are times where I have taken someone's blood pressure medicine and I say, well, This blood pressure medicine helps protect, like an ACE inhibitor, lisinopril. This helps protect your kidneys. This helps protect in heart failure. You don't really have high blood pressure, but I feel like you'd benefit from this medicine. But because you don't have high blood pressure, I can't give you much of it.
Right.
So I'm going to give you the lowest dose, and I'm going to ask you to break it in half. And there's no research that's been done on that dose, but I'm just going to take the data that says this is a med that helps you. Let's take the amount that you can tolerate and hope that you get that help. And if you're not tolerating it, then we stop it.
Yeah.
And so I think we're taking that, what we do all the time, and applying it to these medicines. There are so many people who have been using these medicines in the recent years for weight loss predominantly. But now we're seeing, like with our own scientific eyes, we're seeing the benefits. We're seeing that as you lost weight, you also had all these things. And you're at your goal weight, and we removed it, and you didn't gain weight, but you feel these other things.
Right.
And then you put the medicine back on board, and you don't. You know, I don't know that you have to have a double-blinded study to say, well, that makes sense.
Right.
And to treat the person in front of me and help them to be as healthy as they can be, this makes sense. And I like that the microdosing. So, you know, if you just Google microdosing, you're not going to get anything about
You'll go
GLPs.
into a land of weird mushrooms.
Yes. Microdosing mushrooms, microdosing ketamine, lots of stuff happening in psych where we're microdosing some of these psychedelics. And microdosing there really means taking a tiny, tiny dose of it. I personally have done microdosing off-label use for people with autoimmune diseases in microdosing naltrexone. And so naltrexone is used for addiction, and it's used in over 100 milligrams. And I'll give people 1, 2, 3 milligrams because there are doctors who have found that this helps. We don't have a lot of treatments in this. And the people, I educate people to say this is off-label use. Would you like to try it? And they're like, I'm desperate and I feel horrible. I would like to try it. And if it works, we continue and we play with the dose. With GLPs, it's not just, sometimes it is just using a tiny dose. We're not trying to get your A1C down for diabetes, and we're not trying to help you lose 50 pounds. We're trying to help with inflammation. Maybe you need less medicine. I think we all practice from a less is more when it comes to prescriptions.
Yeah.
And I want to give you the amount that does something at the lowest dose possible. We all know when you get more medicine, you get more side effects.
Yeah.
You get more drug-drug interactions. There's more negative that comes with it as well. And so I'm going to give you the minimum amount that's going to work. So maybe it is the absolute smallest dose that the research says is never going to do X, Y, Z, but it takes away their inflammation, gives them more energy, makes them feel good. Then why can't we stay on that dose?
Right.
Why would we pull that away from someone who it's really helping them live their best life?
Yeah.
But then there's also custom dosing. So the research, let's take tirzepatide because those numbers are easy. So Mounjaro, Zepbound, goes from 2.5 to 5 to 7.5 to 10, 12.5, 15. Those are the doses. Well, what if someone got to 5 and they felt, I think I'm starting to feel some side effects. And so then I'm like, well, I want to drop you back down to 2.5, but nothing good came of 2.5. Why can't I give you 3?
Yeah.
Why can't I give you 4? And the great thing with the compounded medicines is you can get it compounded in those in-between doses. If I were to send you to the pharmacy, it comes as an auto-injecting pen, and you hit the button and it gives you 2.5. You hit the button, it gives you 5. There is no in-between dosing.
Right.
So by using the compounding pharmacies, we can get that in-between dosing for the person who 2.5 was too little and 5 was too much. And I think that custom dosing helps with weight loss, helps with diabetes, but helps with all these other things too, and it makes good sense.
Right. Yeah. And the compounding pharmacies that I use, and I know the ones that we use here, are safe, reputable compounding pharmacies that have been around. They know what they're doing. I think there's sometimes a bit of a poo-poo on compounded medications. And I won't go into why I think that is, but when you're using a medication that's made from a pharmacy that is reputable and safe, there is not a danger because it came from the compounding pharmacy.
Correct.
The danger comes in the dose when we use too much.
Correct.
So that's one reason why it's really important. Do not go find research peptides online and start buying them and mixing them yourself at home.
Yes.
This girl, we had talked about it. She would, if you're listening, you probably are because I tell you to listen. But
You will know that
I'm talking
no one
about
else
you.
will.
But she was just, she didn't even, like, I was like, you didn't even ask me. You didn't even ask my opinion, and you've seen me for years. She, like, went on this online thing, got whatever, and overdosed on a GLP-1. And I'm like, why would you trust someone online, and you've seen me for all of your healthcare needs?
Yeah.
And you know I'm pretty open.
Yeah.
Like, you need, like, I'm not against, I'm sure there's a place for online things, and you do things online with people, but I also trust you. Mm-hmm. And so, like, go to someone you trust. Do not just order stuff and then just, like, try to figure it out yourself.
Because these are medicines that you are injecting into your body.
Yeah.
Like,
and so I think having a medical provider involved and making sure that the medicine is from a reliable source makes sense.
Yes.
This is, if you vet your children's Halloween candy, then vet the prescription that you are injecting into your body.
Yes.
I mean, come on. I don't even let my kid touch the Reese wrapper that
Till
looks
I'm
like
looking
someone
at
might
it.
have touched the end of it.
Has
that been broken open?
Yeah, I need to eat a few of those Snickers to make sure they're okay.
Safe. That's exactly right. And so it really is like, you just can't go willy-nilly on this. But the compounding, there's I think we have vilified. You are kind and you're not going there, but I am going to go there. We have vilified this because pharmaceutical companies don't make money off of the compounding pharmacies.
Right.
And there is politics to medicine and access, and these are very expensive medicines. And if we can make sure that the demand is so much higher than their supply, then they can charge a ton. And it's capitalism at work, and it gets in the way of people getting good care. Mm-hmm. And so having, and our compounding pharmacy that we use are pharmacists that we know that have been well trained, that are very intelligent. I don't know the person who's working at the factory at Eli Lilly or Novo Nordisk, but I do know this pharmacist, and I do know that they take serious making a product that is safe and effective. And we buy directly from them, and they do all of their sterilization, and they make their medications very carefully. And so it is safe. Mm-hmm. Now, I don't know about the place that maybe portrays itself to be out of San Diego, but is actually out of some third world country. You just don't know these things.
Yeah.
And so you've got to be safe, and you've got to do your due diligence. And I think getting a trusted medical provider involved helps with all that, because we've certainly done our research. Mm-hmm. I also, so if you are interested in microdosing, or you are interested in custom dosing, you're not going to be able to do that with what you get at the pharmacy. Mm-hmm. That has to be through a compounding pharmacy. And I think there's just a little conversation to have around access of these medications in the compounding pharmacies as well. Yeah. So I appreciate you saying the compounding pharmacies are safe. Now, why is it that we can even, these are branded medications. They have not gone to generic. Why is it that we can even access them as their generics through a compounded pharmacy?
Well, the compounding pharmacies can kind of go around in a little loophole to, sometimes they add something to make it just slightly different, or they make it available in a dose that's not available commercially. Right. Sometimes, as with GLP-1s, they're listed as peptides, and so it's not a medication, it's a peptide. I'm doing air quotes if you're listening. Mm-hmm. So that makes it a little bit easier for compounding pharmacies to be able to do this. Now, the problem that we're running into now, which is coming in February and March, is that the FDA has decided tirzepatide is commercially available enough now that compounding pharmacies are not needed, which I say baloney. It's going to be a bad thing. It's going to cause patients to lose access to these life-saving drugs. Yeah. But that's one of the things that we have to fight against, and that we have to constantly try to keep up with, is what's going to be available and in what doses.
Yeah.
And so there's a lot that goes behind the scenes.
And I'm thankful for research, and I'm thankful for the brilliant scientists that, you know, do work for companies and create these drugs. And
I am well aware that Novo Nordisk and Eli Lilly had to pay for a lot of that research. I support that they need to sell.
But then patient
medicine.
access is the thing. Yeah. And that becomes, and cost is crazy. And so with compounding doses, it tends to be a little bit more cost effective. You know, I know it's still expensive, but it becomes more cost effective. Mm-hmm. And so I'm not saying like, oh my goodness, all pharmaceutical stuff is bad. Like, don't mishear us, because we are thankful for the research. And we're thankful for the FDA that approves the medications that then we can have access to patients. But there has to be something, now this has become a completely different podcast, but for patient access.
Mm-hmm. There has to. And so really the bottom line is that compounding pharmacies have always existed. Yeah. This isn't, you may have just heard about them because of all of this. Yeah. Yes. Compounding pharmacies have existed for multiple reasons. And the two biggest are probably that if there needs to be something that is different than what is mass manufactured, they can make it in their local compounding pharmacy. If you're allergic to a dye that's in something, if you need this ingredient but not this ingredient, the compounding pharmacists are very smart and they'll be able to custom make that. We compound a lot of hormone replacement to say, here's your lab levels, here's your symptoms. Now put just the right amount of estrogen, progesterone, and testosterone into this topical cream that is customized for you. So making it very customized for a person who needs something that's not available through the branded drug is one workaround that allows compounding pharmacies to legally do this. And the other is if something goes onto the national list of medications that are in shortage and it can safely be compounded, then compounding pharmacies can make it to help with the shortage. And so that's a really big deal of what's happened with semaglutide and tirzepatide is it's because it's in shortage. But it was very interesting when tirzepatide months back was removed from that list. At that same exact time, we had people coming and saying, can I get it compounded because I can find 5 and I can find 12 and a half, but nobody in a 3-state radius has a 7.5 dose, and that's my dose.
People will go searching for them.
Yes.
Like, I mean, I have patients that will
it's
look
coming
at
off
10
the
pharmacies.
shortage list yet. We have patients sitting in front of us saying, I'll pay cash and not run it through my insurance because I can't find it anywhere. And so how is it off of the shortage list? And then as it gets approved for all these other things, how will it not be on the shortage list? It is not available. So I would argue that it's not available. And if you are a person, no matter where you are, who is using compounded medication for semaglutide or tirzepatide, you can contact your local politicians. You can contact the FDA. You can let them know that you cannot find this, that it is not covered by your insurance, that you don't have access to it. And hopefully that will be taken into consideration when they're trying to say, should we compound these medications because the availability is not there, even though the people who make trillions of dollars off of it would like for us to believe that it is there. But one of the great reasons for compounding these medicines is the custom dosing, because it doesn't come custom dosed when it's mass manufactured by the pharmaceutical companies. So always good conversations around semaglutide and tirzepatide. So much to talk about there. But we are all on board. They are wonderful medications. We are learning lots.
And there's new ones coming.
Stay tuned. They're taking this as a foundation to build so much more from. I think it's going to be one of the more exciting things that's happened in our careers. So hopefully this has given you a little bit of information on some of these buzzwords around or that you might be hearing on microdosing these drugs. And hopefully this helps you know if this might be of assistance to you in your medical needs. We thank you for joining us today and welcome you to join us on our next episodes released in 2 weeks. Until next time, take care of yourself. We like to leave you on a good note. So here's today's Tell Me Something Good. Something good is walking, and particularly a nature walk. I like to multitask. Time is valuable. So if I can take in nature, calm my mind, and get exercise, that is a good thing. Nature walks. Give it a try. Thank you for joining us today. And until next time, take care of yourself.